like to speak to you today about the professional career of physical therapy. And first I will tell you a story. This story is about a young soldier named Thomas Neathway. Thomas Neathway was a lance corporal in the British Army, and they were serving in Afghanistan when one particular day in 2009 he picked up a sandbag and there happened to be a bomb inside. So unfortunately he was injured and he lost both of his legs and most of his left arm. So after the accident, Thomas was taken back to London, to England, where he had to go through months of physical therapy. And what do physical therapists do? I'd like to explain what is physical therapy. Physical therapy is for the management of pain. It is also for helping people to have functionality after they've been injured or had surgery or disease. And it is also to help people with mobility and so that they can live a normal functional life and be active in the best way they can. And according to a professional physical therapist who has 5 decades in this work, named Bernice Hansel is her name. According to her, she says that you must treat the entire person, the mind, and their social behavior. So many times physical therapists are teachers. They have to teach people how to live, how to function, how to do the things that we normally take for granted every day. Physical therapists in the United States work full-time, usually 40 hours a week. The annual income is about $75,000 a year. That's for American wages. And who do they treat? Physical therapists treat anyone, even infants to elderly people. So they treat all kinds of people. They work with many different people, and where do they work? They might work in a hospital, they might work in a private clinic, they might even go into homes and take care of the people there, elderly people or disabled people. And so another physical therapist who's also been a physical therapist for many years, named Heidi Zare, she says, a lot of people believe that physical therapy is just exercises. But in reality, our goal is to get the patient better. And we do exercises, but we also do tests to figure out specific ways for them to meet their next goals. So a physical therapist has to work with many other specialists, doctors, nurses, pathologists, dentists sometimes, and to help the patient find the best way to meet their goals and improve their life. Most of us don't like to go to doctors, and maybe we wouldn't want to have physical therapy, but it's necessary for sometimes in certain cases. I'm going to tell you a little joke about going to the doctor. A man came to the doctor and he had an apple in his right ear, a tomato in his left ear, and 2 carrots in his nose. And he said, "Doctor, what's wrong with me?" And the doctor examined him and said, "You're not eating properly." So sometimes we have to be cared for, whether it's something that we enjoy or not. And why do people need physical therapy? Maybe they've had an accident, maybe they've been burned, maybe they've had arthritis, maybe they have back injury, neck injury, spinal cord injury, maybe they've had a stroke, or they have different muscle diseases, multiple sclerosis, cerebral palsy, and different other conditions. And what kind of therapy do the physical therapists do? They may do therapeutic exercises, they do physical exercises, training, manual therapy. They use assistive and adaptive devices to help people, such as Thomas, who needed special artificial devices so he can walk again and use his body. They use physical agents, and they use electrotherapeutic modalities. And so the therapist works with a lot of professionals, as I mentioned. And of course, one of the main qualifications for physical therapists on a government website in the United States, it said, is compassion. And so they need to have compassion on their patients, and they need to have patience with people. So I really thought this is a very interesting career, and especially for a Christian. We know that Jesus said he looked at the multitude and he had compassion on them. And as a Christian anyway, we are supposed to have compassion. So whatever profession we do, whether we're just a wife, a mother, or a husband, or a friend, or whoever we are, if we have a professional job or if we have a very common job, we all should do whatever we do to glorify God. And we should seek to do what God values and help others, whether maybe we won't have a professional career, such as physical therapy, and God's not called everyone for that. But we need to show God's love and compassion to those in our lives, to those that we can help every day.